Welcome into HealthWise, the TV show. I'm your host, Ralph Hipp. Now in its fourth year as part of the Mayo Clinic Care Network, Stormont Vail continues offering world-class health care right here at home in Kansas. And they're doing that while drawing on the extensive knowledge of the Mayo Clinic specialists through digital tools and services. They're available only to the healthcare systems that they work with. Dr. Clifton Jones is my guest today. Dr. Jones is the Mayo Clinic Care Network physician liaison for Stormont Vail, and that very important connection. Dr. Jones, it's nice to chat with you about this.
Good to be here.
Well, we certainly know the names Stormont Vail and Mayo Clinic, and talk about the relationship between the two. How did this all start?
About 5 years ago, Stormont administration felt that we needed to look outside the region, look for opportunities to collaborate in providing excellence in medical practice, nursing practice, hospital administration, more on a national level. At that time, we were aware that Mayo Clinic had initiated their Mayo Clinic Care Network, I believe, in 2011, and we sought inclusion into that organization.
Great. And I believe we're going to show a map that can show this any time now to show the reach of this. These are the other network members all around the nation. So of course we're right in the middle of this big network.
So there's 46 member institutions now. I think Stormont Vail was the 27th.
And globally, it does go beyond the United States borders, and globally, can you describe some of the international partnerships that Mayo Clinic also has?
There's, I believe, two hospitals in the Philippines, one in Manila. One just started a relationship with us in China. I also believe in Dubai.
My goodness, all over the world, in those very varied points of the world. What are the benefits that we see here in Kansas from this partnership, and does it seem to be working well?
Well, I do believe it's working very well. Probably the most noticeable benefit to our patients directly are e-consults. So we have the ability to have consultation on certain cases where we have questions in management or treatment or even in diagnosis with specialists at the Mayo Clinic. The patient is more or less evaluated here in Kansas, and we can collect physical findings, laboratory studies, imaging results, even biopsies, and electronically transmit the appropriate information to Mayo Clinic. There they have a scheduled appointment, more or less, virtually without traveling out of the state of Kansas, where an individual in a particular field that would be deemed appropriate either by us referring or by the people up at Mayo to be the proper person to evaluate that patient.
Is it from the main clinic in Rochester, Minnesota, Dr. Jones?
I think some of them, they usually are in Rochester.
Minnesota.
Some may go to Jacksonville or Scottsdale.
Right. Personally, as the liaison between Stormont Vail and the Mayo Clinic, what are your experiences with the e-consults that you would say, as a trained physician, this is really, really working well for our people here in Kansas?
So the absolute best examples would be where a specialist in Topeka has undertaken an evaluation and probably comes up to a point where the diagnosis is lacking or the treatment options are in question. It's reassuring. Very frequently our approach and our diagnosis and our plans are validated by a specialist in Rochester or Scottsdale or Jacksonville. The bottom line would be a patient can get a second opinion without having to leave Topeka or the state of Kansas.
With the expertise of the Mayo Clinic.
Exactly.
Right. Of course, as you know, Dr. Jones, the healthcare industry is based on outcomes. How are the outcomes for our patients in the Sunflower State?
Well, I think very good. I think the basic health care that people are getting here is excellent. I think there are individuals that have such complex medical problems that an additional point of view or perspective would be of value.
Right. This liaison that we have, and what is your role in making that work, Dr. Jones? Your role in participating in the partnership?
So they have their own medical directors who I believe have 1, 2, or 3 year terms, people that are active clinical practitioners of various specialties at Rochester.
In each of those 3 spots in Jacksonville, Scottsdale,
they have
an
eastern region, a Midwest region, and a western region. And so basically when we have opportunities to interact physically. I will go up there or they will come down here, and we have interaction there, and we get to know the liaisons, the medical directors, and their administrators are also present in a liaison role.
Right. Are they thrilled with participating in Stormont Vail Healthcare? What do they say about us?
I think they love what they do. They vetted us very carefully before we were accepted into the network, and realized that we have a like mind as far as what we're interested in, what our focuses are in healthcare.
Dr. Jones, does it help in recruiting healthcare providers here in Topeka?
We discuss that with recruits, and again, they're fascinated with the opportunities. I'm not sure if that's the only reason they would choose to come here, but I think it is a help.
Right. And we want to also give you some more information on the screen here before we wrap up. We're with Dr. Clifton Jones, who is the liaison with Stormont Vail and the Mayo Clinic, stormontvale.org. And anything else you'd like to say about the partnership? And how do we get involved? How do we ask questions about what you're doing together with the Mayo Clinic?
So a patient certainly that is seeing a physician affiliated with Stormont or Cotton O'Neill would have the option of requesting an e-consult if the results they were getting, the answers they were getting were not what they wanted. And so again, that would be something that we would undertake.
Right. Should they make a physical visit to Stormont Vail and can they request a Mayo Clinic partnership visit?
They certainly can make that request. They pretty much have to make a physical visit because the physician in Rochester or Scottsdale isn't going to see the patient. Somebody has to have hands-on.
Not something in Topeka that we would call about. You need to come in and discuss on the bigger picture and the wide scope of this partnership and helping them out.
That's right.
All right. Dr. Clifton Jones, thank you for coming over.
Thank you, Ralph.
The liaison with the Mayo Clinic in Stormont Vail. And of course, you can always visit. Where should they visit to get the process started, Dr. Clifton Jones?
Their primary care physician.
Through the primary care physician and then the referral, and tap right in from Stormont Vail and right here in Northeast Kansas to the expertise of the Mayo Clinic. It's been fascinating to see how this partnership works with those home bases in Jacksonville, Florida, Scottsdale, Arizona, and the main Mayo Clinic in Rochester, Minnesota. The direct link right here to Topeka, Kansas. And Doctor, thanks again.
Thank you.
Well, next up, get warmed up. We have our HealthWise TV exercise segment. We have some fun and invigorating, some rather low-impact exercises, easy for you to do. Check with your doctor before you start this or any exercise program.